to say that we're really fortunate in Rhode Island to have leaders such as Courtney and Anna who really understand this from the heart and want to do the right thing. And I think the challenge that Anna just laid out for all of us to help them move forward from the state agency level is really an honest request. And so certainly at EPI we're very interested in working with everybody and doing that in the Immigrant Coalition, which is soon to have, now has an attorney on staff and soon will have a facilitator. I think the coalition will be a leader in helping to garner that information and lay out some strategies for how we can make sure that everybody feels safe applying for the benefits that they're entitled to. So we'll be moving forward together on that. Questions or stories or things you would like either of the deputy director or the director to know of what you're seeing in community? Okay, Juan's coming to the back. I really do think that stories can help bring to life issues that we need to be working on together with the state agencies. So I don't think either of the women up here would mind hearing where things are not going well, or if they're going right. Go ahead.
All right, thank you. And I don't mean to monopolize the microphone here, but I'm very interested in this subject. And I have one question for each of you. Deputy Director Namish, could you talk a little bit about how healthcare should be thinking about documenting people's status in the electronic medical record? It is a question that I get as a support. I do a lot of support for health and human service teams, and I think that we know that these are legal documents. So I'm just wondering a little bit about what your thoughts are on that, and whether or not the Department of Health has any policy or guidance around that. Because I imagine each institution's general counsel will have different opinions on what that would look like. And for Director Hawkins, my question is around documentation from your perspective and how that gets shared out to federal government agencies, and whether or not we have any internal policies that we can use to tell people, assure them that information with the Department of Human Services is safeguarded, and that should not be the reason why someone's not applying for an essential benefit. Thank you.
Well, that was easy.
So on that side, we do not have a stated policy around how to collect specific information. We have standards for data collection that include basic demographics, race, ethnicity, those things that are important for us in terms of helping with policy and keeping with disease trends. Legal status is not part of it. That being said, I also understand from a provider perspective the need to collect such information, not because it helps inform disease trends and so forth, but mostly in an attempt to support a patient accessing benefits. So there is always this tension between how do you collect the information to help someone access benefits versus collecting information that people may be feared of in terms of be afraid of providing. I remember when we were doing charity care forms, that was one of the questions. Should we be putting Social Security in there? The providers wanted to put Social Security as part of the charity care benefits because if they have Social Security, then they can support someone accessing benefits through Medicaid and so forth. And if you don't, you may delay in that process. And so we compromised at the time by saying just put Social Security, but put if available, meaning that if not available, that's fine. It's clearly spelled out on the form. And the only other thing that I would say is that if it's collected within a health form, it is as part of the general information that is protected by confidentiality. And so, but that is really handled differently from agency to agency.
So that's a tough question for me. I'll say from a law enforcement perspective, no one in my department is authorized to release anyone's information unless it comes to me in my office. So one thing we did is ensure that people understand that if someone walks into an office and says, with a name and says, give me what you know about this person, that no one in that office is authorized to do that. But we have thought a lot and are trying to refine our thinking about, for the federal agencies that fund our programs, you know, if Food and Nutrition Service decided tomorrow to come in and ask for a roster of food stamp recipients, I'm not sure the state would have a way to protect from that. And so that's why when we think about what we collect about people, it's really, really important, especially people who potentially apply and are not qualified, or people in mixed households. And so that was our first step in making sure that while we're also thinking about the worst case scenario, if that were to happen, what could we do? It's also, in the meantime, making sure that we are capturing our data in a way that it wouldn't compromise people if we're able to do that.
If I could, I just wanted to add, we had, in the work that the Immigrant Coalition is doing with the Department of Health, we also talked about gathering information about people related to their health care. So we know that immigrants, and I think Katya will talk more about this on the panel, that families now are under a tremendous amount of stress because of what's going on around us. And so how does a healthcare provider, not a hospital financial person, but somebody sitting with a patient, address those sort of issues, right? So that's a whole other area, I think, to talk about. And I also just want to add the public charge issue. We really do need an immediate strategy about getting information out to people about where public charge is not going to affect somebody, because in reality, if this goes through, the directly impacted people are fairly small numbers, right? But there's a lot of fear, as Connie went over. So providers, so for example, for WIC, if a family gets WIC benefits, that's not going to raise a public charge concern, but how do we make sure that the WIC providers know that and give information out about the broader issue about accessing other benefits? So we have a lot of education to do, and working through the networks, both the DHS and through health, we can try to figure out how to disseminate that information. So, another question?
I guess that's related to my question. I'm a medical student. I'm here with the medical students, so thank you for having us. But a lot of talks that have been brought up today, points, we're not really taught in medical school, and we see that in the shadow or in the hospitals that providers that we're working with don't really know what's going on and they're untouched. So I guess that is my question, is how can maybe the Department of Health or something with the healthcare centers that we're working in, how that information can be disseminated, and maybe these trainings that we've heard are so important can be more standardized and implemented throughout healthcare centers in Rhode Island.
So it's one of the things that we've been planning and are working on. It's developing some of the trainings that have been presented, maybe put them on a video format, make them available through our internet, to our webpage, to any provider. Talking with the hospitals have grant rounds, and so we have relationships with the hospitals, and we discussed maybe having a grant rounds at the hospitals around immigrant health and immigrant rights, and provide expectations and trying to address what is our expectation as a health system of provider behavior. So those are things that we are working in collaboration with the Immigrant Coalition, and that we hope to put forward as we go along. We have some meetings that are standard meetings, and we're trying to use those also as opportunity for more information. So we meet, for example, with the medical directors of all of the health plans, and we had that discussion with them. We have a primary care advisory committee that has representation from small providers to large providers and community health centers, and we will bring this information into those settings. It's more really looking at those already built-in opportunities where you can bring the information and start addressing it. I do lectures at Brown with the School of Public Health and the medical schools, and I can guarantee you that that will be part of the message.
Other questions or comments? Well, yeah.
manage the Immigrant Victims' Rights Project at Dorcas International Institute of Rhode Island. And recently had an experience with a client that I just wanted to share and raised a couple of questions for me. She was an immigrant with 2 daughters who were also immigrants, undocumented, married to a U.S. citizen, became a victim of domestic violence, fled the home, living in the basement of a church when they found their way into my office. We've been working to file some applications, file a self-petition to help fix their immigration status. But in the meantime, this client who has two teenage daughters was, in need of help, and especially in need of medical care for the teenage daughters and also herself. She had a very painful situation going on with her teeth. And I kept telling her, that she was out. There are exceptions for VAWA petitioners, and she was eligible now that we could file this certain kind of application. And we kept making plans for her to go to the local office and apply, and I helped her fill out the form. She had been carrying it around for months. I was not able to do it. I finally, took the morning off and went with her to the office to sit with her through that whole experience. It was, very tearful even to just walk into the building, and all of this is due to what she's hearing in the community about, public charge and all of these things related to immigrants. So that is the level of fear that is walking through your doors, on a daily basis. This is just one example. I did go through the whole process with her that morning of the different steps, and when we ended up with someone back in the office when they were processing the application, when it came to the part, where they're plugging it into the computer, it seemed like there was some technology issues getting in the way, and then for some of these exceptions, particularly for immigrant victims, there just wasn't a drop-down menu that provided that exception. And I am very grateful for the work that we had, kept at it and sat there and found a supervisor, another supervisor, and another supervisor. She said, I know there's this workaround, but I'm not sure. And they did finally figure it out, and gratefully, my client and her daughters now have medical benefits, which they are entitled to, and which will not be a public charge issue because they're accepted from that as victims of domestic violence. But I can't help but think 2 things. One, if I as an attorney was sitting there with her, with that worker, have kept at it so much. But also that, there's technology perhaps and training in the way. There's just one supervisor in the building that knows how to do this workaround. I'm concerned because I have a lot of other clients who've gone on their own and end up coming to me saying, I'm not eligible, and then I write a letter, and eventually it gets worked out. But so thank you for being here. Thank you for your honesty that more probably needs to be done. Thank you for your commitment to that.
Well, thank you for that. Yes, you cannot have my job and not be deeply humble. I'll tell you that what I'm glad to hear, and the kind of culture that we're trying to build in the department for this community and others, is the tenacity that you described of the workers, because we do want people to persist through. There are issues that are exactly what you described. I'll say to you that we know what they are, and we will fix them. We've made a lot of progress, but the kinds of issues that you described that are highly complicated and technical are just, it's good in some ways that we're at a point that we can focus on those things, but because we were not so very long ago not able to get benefits from anyone, we are just now in the place where we can focus on those things. So I want to be sure that I understand the details of this, and I'll come find you after. But there are a handful of things that we're working through, and I would just say to people in this room that this is true for any issue. If you hit a worker who won't work hard on it and get to the next person, if you have someone who is getting an answer that you think is wrong and you can't resolve it, you should escalate it to my office if you need to. And we handle that kind of thing all the time. It's it's good because it helps me know what's going on, and it also helps me reinforce into the field the kinds of issues and make sure we're aware of them. So, you know, you have my commitment that I'm available to anyone who needs to escalate things to me, and people do that. I hope that over time that need won't be there, but it is where we are. And it will be a process of shifting, you know, the work that we do to be sure that, you know, everyone leaves with what they need on that day. So thank you for that.
Okay. Oh, one in the back, then we'll get to you, Jen.
Hello, I work with the Providence Community Health Centers, and I do want to let you know that we do have a statement on each of the registration booths in which we let the patients know that this is a safe place for them to be regardless of their ability status. I know I'm realizing today that we need to do more than that, you know, really explain to the patient what that really means. Although they know, when they have raised the question, they know that we are there to support them. But I think we need to do more work. But before I sit down, I have to say thank you to the Economic Progress Institute for bringing this this conference together. This is very meaningful to me as a social worker and also at the personal level. As an immigrant who has seen for the past 40 years many very sad stories and never changes. So I hope this opportunity here is not just to learn about the statistics of how really the immigrant community has contributed to the economic status of the United States, but mostly those are documented. And unfortunately, it's not that I'm nervous, I'm very emotional. And because just in the past week, I have to help a family who the father was diagnosed, he has been in the country for 20 years. As an undocumented, working in Texas, in construction for 20 years, building homes for many of the American families. He was diagnosed with a brain tumor, and he was denied treatment in every single place that he reached out to his family. Someone reached out to me, and I was able to bring him here to Rhode Island, and thank God he's going through the process, but it's kind of late. Many months trying to get, and this is many immigrants have to go through this. We have seen people, and I know I have worked with Patricia for 40 years, that means that I'm not at all, but and we have seen immigrants die because of lack of assistance. And please, this is not just a conference for you to get data, but also to be more sensitive about the lives of the immigrants. We are human beings. Please go and continue to work.
Just in responding to Linda's request that we do share stories that will help help your staff. We at the Center for Justice do a lot of housing work, and we did have a family who lives in Woonsocket. And I think that the issue that we understood and that was raised by this family really highlights the need for additional staff training around mixed status families. I think it's a very complex set of legal issues. I know that it's hard for everyone to understand. The keynote presentation here today highlighted how complex those situations can be. But in this particular instance, and it's not an isolated instance in our experience, this family approached the DHS office. They live in Woonsocket, and because of mixed status in the household, although there were U.S. citizen children, they were turned away. And unfortunately, that in that instance, it didn't get escalated through the local office. I'm sure I had a supervisor or multiple supervisors, like in Cecily's situation, been contacted that it could have been corrected at the point of initial contact, but that family did leave because they were given misinformation about the fact that that no one in the household would be eligible as long as someone in the household was not eligible. So, you know, I know that happens, and obviously I think that just highlights the need for the staff training as well as the technology issues. Which
yeah, absolutely. I mean, when you turn over 250 people in a year and a half, which I know you know, we're teaching people like what are SNAP benefits. And so then to get into program the details and complexity of all of the programs, we integrated 16 programs, and the idea that was that workers were going to be able to all of a sudden know the rules for 16 programs. It used to be that there was a team that did one thing and a team that did another, so people really knew their program. Now we're on a path to helping people learn the rules for everything, but what's interesting about integrated eligibility is that the federal rules have not been integrated. And so the staff literally have to learn federal guidance for every program we run, and when you layer that in with new staff and the issues we've had, it's challenging. And so I think it's why I'm grateful to have partners, and our legal colleagues are great, and they escalate stuff. We're at a point now that the department at least has enough of a relationship that I think people understand we're trying to do our best, and if you bring it to us, we will resolve it. But it is what I think about all the time, because it just takes one interaction with one worker who's having a bad day, who doesn't turn around and ask someone, and they send the family away. And I want to acknowledge the emotional story about what it takes for someone to walk in an office. I do understand that sending someone away once is a big deal. And it is also why it's my perspective that some of our work is best done through partnership. And why, you'll hear me coming to you all in the future to say, please help us do this work, because you may always be better than we will be at being able to do it. Yes.
Thank you. This is great information, and I like your approach about working with partners. One of the big issues is that on top of being a complex information, and it's hard for us to understand, there's also a lot of misinformation in the Spanish media. And one of the biggest issues that recently happened was that Telemundo, national television show, was telling stories of people who were permanent residents, who were traveling outside the United States, who were receiving any kind of assistance, were stopped at the border at the airport, coming back and deported. And that caused a ripple effect all over the United States. So there's a lot of issues going on, and it's important for not only a one-time conference, but to also develop, through the coalition and other organizations, really understanding of what the policies are and how to support and advocate for people who are being turned away, who are having challenges in communicating and a whole number of things.
We'll get to you.
I wanted to say thank you for being here, and also in this time when with the public notifications of immigrants, and we understand how the perceptions are affecting policies and funding, what are your offices doing to regain, change that narrative of immigrants and undocumented people?
So I can speak for the health department. It's a complex question, but I think, in a sense, the answer should be easy. Because the narrative, we create those narratives. It's not somebody else's narrative. We are all part of that narrative. And so I think if we all take ownership that we are part of the message, that we create the narratives, we also can change those narratives. It's about committing to do that. At the health department, I started my day today on the other room. We had our Health Equity Zones initiative, Learning Collaborative. I invited them to crash this party. I didn't check with Linda. But I told them, if during breaks, if you see the Immigrant Coalition folks out there, make sure that you reach out and you connect, because it's the same community. It's our community. And the stories that are coming out of our community are our stories. So we are part of the narrative. We have a tendency to put a distance to it, but we create those narratives, we can change those narratives. We are also have been working with our congressional delegation, in fact, because we have a weekly phone call And so that's the other way that we also have been trying to not change the narrative necessarily, but make sure that they hear what our story is and what our narrative is. That is one that values our community, one that values every single one of us as equals. We all contribute. My friend put it so well, we are all people. There is no difference at the end of the day. We are all contributing to the success of this state of ours. We are all contributing to the success of our nation. But many times, what is the unmarked things, the invisible things, become big. And so it's on us to make them visible, to call them.
Yeah, I would say it's my mission and my job to change the way in our state we talk about the people that my department serves broadly in its entirety, including immigrant families, but including everyone. The things people feel like it's okay to say to me about the people I serve are, it's the worst part of my job, frankly. It's disgusting. And the perceptions of vulnerable people and families by lots of people in the state is something we have to overcome. And I feel like I have the opportunity to help us to do that. And so part of what I hope to achieve is with our partners like Linda, who put out, and EPI, who put out a great report on Rhode Island Works, to talk about who our families are, what the measly benefits are that we are actually providing, how our programs are ineffective often because the policies we've put into place don't allow them to be effective, and to talk about this idea, are we going to be a state that believes in opportunity for all people? And I'm proud to work for a governor that is talking about ensuring that all people have opportunity and that all families can benefit from the state's progress. And I think part of what we have to do is refine that even further and talk about what does it mean to live in poverty in our state, and how do we really create pathways of opportunity for people. And that would include immigrant families, but I actually see it kind of more broadly for that because of who we serve.
So last question.
So we realize the difficulty of just having civil servants who understand all the nuts and bolts of the different regulations that they need to supervise, but very germane to changing the narrative. I'm wondering if there's ability to bring implicit bias and racial equity training to your staff. It's sad that we now have an ideological split, and clearly every civil servant has the right to be who they are outside of that office, but it feels like if we had more of a foundation of what implicit bias is, what racial equity is, what is our history, it might help them, better understand the regulations that they are set out to uphold.
I think that's an excellent point, and something that I hope that we will achieve. I do want to just say that in my experience, the staff at DHS are some of the most amazing people I've ever worked with, who have really persisted through some unbelievable things to ensure that people get benefits, and do that every day, day in and day out. But to your point, everyone brings their own biases to their work, including myself, and giving ourselves the opportunity to talk about it and train and build a culture around it is something that I hope that we will be able to move to as we move from a place of crisis to more stability, and where we have more opportunity to do that. So I think it's really important and good feedback, and I hope that we are able to do that.
Great. And Senator Cano has a point to make about this.
Right, thank you. Thank you, Director, for your remarks, and thank you for the question. Currently, in the Senate, I'm sponsoring the legislation to do just what you said, to provide cultural competency to all the statewide staff members in Rhode Island, also have a sponsor in the house with Brett Chamley, and he's also trying to move that legislation through this legislation session. So is that to support the Francis Point and all the departments, working with the Department of Administration and the Office of Diversity and Training, just to make sure that we'll have the model for all the statewide employees to have the same training. So it's currently happening. Thank you for the suggestion. Hopefully we can pass that legislation, but I encourage everybody to support it if you feel that it's important. So thank you.
Great. Deeply thank Deputy Director Innovation, Director Hawkins.
Can I make one thought before I leave?
You're going like this. So I just want to say, while I have you all in the room, that the governor's budget this year does include a really important change to the Rhode Island Works time limits in Article 15, which affects the very people that we're talking about. Rhode Island is one of 9 states that has an intermittent time limit. It's the most regressive welfare policy you can find. And this would undo that and allow people to receive a straight 48 months of benefits, which would mean you would have to come to our office less frequently. You wouldn't get a confusing notice telling you you're getting kicked off even though you're doing everything right. It's way better for our families, and as you can imagine, politically hard to sell. So it's in the budget, which is great, but if you all are out talking to folks, if you can ensure that you can tell them that Article 15 is good for the people that we all serve, we would appreciate it.
Thank you.